Friends, this is Shalini from Akshara Global Academy. Today I am going to present you regarding OET speaking section. The case presentation I am going to present you is a patient who was admitted to the hospital who is planning for doing a procedure. The procedure name is balloon angioplasty. And the patient has so many doubts because this is a second experience and means the patient who already done the same procedure long back ago, and this is the second time and he has so many concern. This is one concern why these kinds of procedure is doing again. And second is patient is an old age patient, and patient has so many concerns, and our patient has no other social supports. So there are so many concerns, we have to deal that concerns each one. We have to one by one we have to deal that concerns. So I will act as a patient, I will act as a nurse, I mean both. I will act as a patient and nurse. Today I am dealing regarding how we can deal this kind of concerns. So the task include, what are the tasks you have to do is, now the setting is hospital ward, and the patient was, I already told you, patient was admitted to the hospital ward for this procedure. Very next day he will do the procedure, I mean the doctor will do the procedure. So you are the nurse, you are the responsible nurse to deal his concerns. The task includes, you have to ask the patient regarding his lifestyles, I mean diet, exercise, and social habits. And you have to ask regarding social supports, and you have to deal the concerns. If the patient is reporting their concerns, you have to deal that concerns very politely and very friendly manner. In the speaking section, you are keep in mind these all the things. And next task is, you have to give some suggestions regarding how we can prevent these kinds of these I mean diseases. This is a way how we can how we can deal this speaking section. So let's start. First starting is from the nurse side. So if I am the nurse, I will act as like this way. So let's start the section. First of all, you have to greet that patient. Good morning. Good morning. As you know, I am so and so. So let's mention my name. If my name is Reshma, you have to introduce. As you know, I am Reshma. Like this way, you have to know why it is as you know, because the patient, or you already know that patient. I mean, the patient already know. This you are a patient was admitted to the hospital ward, so you already know that patient, and patient already knows you. So that's why, as you know, I am so and so. You have to mention your name there. Okay. So how may I help you today? Okay, like this way we have to introduce as patient. So next side, patient side. So patient will explain according to your your questions, or according to your your questions. Patient will reply to you. So patient will reply like this way. Nurse, you are right, very right, because me has so many concerns, as this is the second time at hospital, and why I am here. I am very concerned. I think my surgery, the previously done the surgery was very successful, but the same surgery doctor is planning to do for me. Because of that way, because of that thing, I have so many concerns. Please deal my concerns. So how you can reply this one? If the patient is reporting like these kinds of concerns, how you can report? I mean, how you can answer this question? That is the your role. Okay, so you have to answer that patient's question. Okay, that's a good concern from your side. I know you have so many concerns regarding the procedure. As this is the second time at hospital, I know you, even I may in the same situation, I may think the same manner as you are thinking. I can understand your concern. But try not be worried. At this moment, you are safe because the experienced doctor is dealing your condition, and your question question is reasonable. I will explain to you. Before going that, I need to ask about so many things regarding your background. I mean, especially your lifestyle habits and your social habits. Please explain. If you don't mind, please explain this one. No, I have this dietary pattern. I am thinking my food daily. I am depend upon outside food. Since my wife demise, I am depends upon outside food. And about the social habits, I didn't drink, didn't drink, but I smoke 10 to 20 cigarettes daily. So this is a patient side answer. So how you can deal this situation? That is your, I mean, depends upon your talent. Okay. So you have to you have to ask you asked that patient lifestyles and diet and I mean social habits, and patient answered according to the his I mean lifestyle change lifestyle habits he answered. So how you can deal this situation is next one is. Okay, so that means according to your discussion, I understood that you are depending upon outside food. And that may be the reason why these kinds of disease is happening again, because outside food contains so many ingredients and coloring materials, so it will increase your disease status. Okay, are you getting my point? This is the way how we can understand the patient is getting you, and and the patient is following you. So you have to answer like this way. You have to you have to deal this situation like this way. Okay. So next is you told me that you have social habits like smoking habits. You were smoking 10 to 20 cigarettes daily. I know it is very hard to decrease that cigarettes, but you know, need to know about why you are here, because your coronary artery has some blocks. That's why you have you the doctor is planning for balloon angioplasty. So you have to reduce your cigarette. At least you have to reduce one per day, otherwise it is very risky. In future it is very risky. So you have to cut down that cigarette at least one by one per day. Understood? So next is but it's a very happy thing is you didn't drink. That's a happy news. And next thing is I need to know about your social supports. Do you have any social supports? So this is a nurse side questions, and how the patient is answering like depends upon that. We have to answer the patient. Okay. So the patient answer will be like this. Nurse, I have no social supports. I have only small friend circle, and and I'm very much kind of yeah, in a depressed state. That's why I'm dealing with. I mean, I will depends upon these kinds of social habits. What can I do, nurse? So how you can deal this situation, that is a and that is also you need to know. Okay, so you have to tell the patient that no, I know you are very much you have so many frustration, that's why you are depending upon these social habits, but you have to think about your health also. If your health is not okay, how you can mingle with friends and how you can deal your I mean lifestyle habits, or you have to change your lifestyles. At least you have to you have to I mean you have to cook your food once a week, and you have to take a healthy food. Okay, and you have to do the exercise like simple walking. At this age it is very benefitable and it is very good for your health, and because these kinds of preventable disease we can avoid. Okay, I hope you understood about how you can deal the situation and what are the preventive measures you have to do. Are you getting my points? And do you have any more concerns? This is a nurse side question. So how you the patient will react? Let's see. Okay, nurse, I have so many I had so many doubts, but now it cleared. I mean, I know how these kinds of lifestyle habits will, I mean, changes of lifestyle habits will prevent these kinds of diseases, and I know everything. Okay, I understood everything. Okay, thank you for your kind cooperation to discuss these kinds of things, and thank you for your valuable time, nurse. I also thanking you for your valuable time for discussing your matter with me, and you are accepting my I mean advices. Thank you for your kind cooperation. Okay, this is the way how you have to deal this OET speaking section. So the speaking session you have to remember a few many things. Once more I will repeat. You have to do that speaking section in a friendly manner. This is the one way, and you have to speak in polite way. Okay, and the means this the next one is getting the patient. How you are, I mean, how the patient is getting you. That is most important. Once you are not this concentrating there, getting, so the this discussion is very is not effective. Means, okay. So if you are concentrating there, getting also means your discussion is very effective, and the third person will assess you that you are a good speaker and you are a good, I mean, discussing, you are discussing this matter in a good way, so you will get the required score. I mean, they are discussing regarding the score regarding B section. So how you can easily get this B section. Okay, next is very minor grammatical errors will accept. Hope you are about how you have to deal this situation. So please like, share and subscribe. Thank you.